Hi everyone. It gives me immense pleasure to welcome someone whom I've known for almost like 6 to 12 months now, and it was around about the last exam and before that where he asked me on how to prepare for this branch that is Pediatric Pulmonology, and obviously it's a niche branch, and especially the exam also is split into two, as you would all know that Pediatric Pulmo of PGI is a separate exam, and the Pediatric Pulmo plus critical care of AIMS is a separate exam. So it was really he would have to go through multiple decisions which exam to give, as well as whether to keep pursuing or continue with a fellowship, or just PEDS itself is like well enough, right? So all those we'll be discussing today. But firstly, I am like really happy that he could secure this amazing rank in the PEDS Pulmo entrance. That is the first step. Rahul, congratulations again, and let me ask you, how are you feeling firstly?
Thank you, sir. Thank you very much. First of all, it's my honor to speak to you in this platform. And currently, I'm very happy. I would say that I'm a bit relieved.
Definitely. Firstly, let's go back a little bit. Our viewers would like to know where you're from, how your academic journey has been, etc.
So, I belong to Sangareddy, it's a small town near Hyderabad. I did my MBBS from SES Medical College, Mehboob Nagar. And I did my MD Pediatrics from Nilofer Hospital, Osmania Medical College. And then I did 1 year of mandatory SRship in Hospital itself. And then I have joined as an assistant professor pediatrics in GMC Sangareddy and currently working as an assistant professor there.
Great. And like this decision of, firstly giving DM while being an assistant professor and doing, good enough work post your MD, and like the decision to give pulmonology, that was another step. So firstly to give DM and to, zero in on the branch. How did you take that decision?
I would say it is completely individualized, sir. We have to decide whether we should continue with the same MD pediatrics branch or we should be giving DM or not. It's highly individualized. So I thought like after completing MD and joining as an assistant professor, I thought it would be better for me to do DM pediatrics, and there was always a constant advice from my professors. They always encouraged me to do DM and not to stop with MD. This was the advice I received when I was doing my MD and SRship in Nilofer hospitals.
Great. And once we take the decision, then comes the tougher part. Possibly that is the preparation part, the lengthy part. So how was your journey through that? Like especially for INSS, and then we'll go to the NEET SS as well.
So first I took the decision of doing DM in pediatrics, super specialty, and then I thought like INISS would be a I thought that INS is a good choice. So I started preparing for pediatric pulmonology. And again, if you ask me why pediatric pulmonology, I would say it's purely interest, sir. I thought like pediatric pulmonology is always challenging and interesting to me. So I opted for pediatric pulmonology and I started preparing for INISS. Total four attempts of INS, three attempts of INSS I have given, but plus one attempt for NEET SS. But if you ask me like how many serious attempts, I would say only two, the last INSS and this INISS. So initially, when I was doing my MD pediatrics only, I made notes from Nelson Pediatrics. So that helped me a lot, even in preparation of DM, preparation for DM. So,
Right. And especially the juniors who would also be interested in PEDS Pulmo, they'll have this doubt naturally, which one to choose, whether the PGI only pure PEDS Pulmo or the AIMS Pulmo plus critical care. And I know that you would have talked to multiple people and taken a decision based on multiple inputs. So guide your juniors also, like how to make that decision.
so my personal opinion is pediatric pulmo is a good branch, and pediatric intensive care is also good and an extensive branch. So I thought like I cannot do justice to two such vast branches if clubbed together. This is my personal opinion. So if somebody wants to do intensive care, also have some knowledge about pediatric pulmonology, obviously pediatric pulmo plus intensive is a good choice. But pediatric pulmo itself as a DM branch is again rewarding, and also I would say it's a good branch to do.
Yeah, very rightly said. Even I feel that the combination of intensive care plus pulmo, I feel I've seen that majority of them eventually become intensivists only. Very few of them
Exactly.
continue as peds pulmonologists. So if somebody is really interested in peds pulmo specifically, then definitely I think what you have done is a better choice. That is also my opinion as well. Then yeah, coming to the thinking about, let's get a little bit into the detail, like how did you prepare, like students, if somebody is targeting pulmonology, what are the sources and how was your preparation specifically?
So it was mainly based on Nelson, and then initial days of my preparation, I used to go through the video lectures from the other platform, and then later I started solving MCQs from doc tutorials, and then the giving grant tests in doc tutorials, and especially subject-wise tests from doc tutorials has helped me a lot. And I would say my favorite part in doc tutorials is elite tests, sir. So those 20 to 25 questions which are given, I would say they are very carefully crafted. Like even if somebody has not completed the chapter in the Nelson, if somebody makes just, I mean, notes down the topic from which the question is asked in the elite, and if they revise those 20 topics also, that should almost cover the 90% of the chapter. And very rewarding questions they are crafted in elite tests. So that's my favorite part. So making notes from Nelson and then solving MCQs, that should do good, sir.
Yeah, I think two very important points you stressed upon. Firstly, I've seen that even for INISs, I mean, I've talked to many juniors across years. I've seen that even for the specialty part, Nelson is only focused upon to a great extent. Like if you're very thorough with Nelson of that particular specialty, most of the questions are solvable. Even for an example, in terms of peds rheumatology, peds pulmonology, and most of subjects. So that is one area at least should not be ignored upon. Yes, you can go for the more advanced book, but at least be thorough with the Nelson. And yes, elite series we try to, especially in peds pulmo, is one area which is easier to cover because the topics are not very, the number of topics are little limited, so it's easier to cover all topics. And that is what our focus is, that at least the student who is looking at our elite videos, they should know that okay, this topic is important. And especially something like primary ciliary dyskinesia, that is also asked in the NEET ss, and then we brought that into the elite because at least you know that okay, PCD is asked and PCD is important, and that is something that should not be skipped. And so that is how we craft our elites. And yeah, coming to the next confusion that juniors and students will have even in the coming years is this dual pattern of preparation when there is NEET ss plus INISS. Because unlike our PG entrance preparation, it's not the same pattern, right? It's considerably different pattern. So how will you advise based on that, like especially when they are close together? May only INI will be there usually, but if example in November they are very close, so how did you manage that and what would you advise?
So for NEET is such kind of an exam where some question will be asked from each and every topic. And for INISS, it is set. Some at least 50 questions out of 80 you will get from your parent branch. If you are given pediatric pulmo, you are expected to face at least 50 questions from pediatric pulmo, and the rest of the questions are from the general pediatric pulmo. But I would say these rest of the questions may actually decide your ranks. For example, one of the exam what I have given INISS, that had actually close to 10 to 15 questions which were asked from pediatric hematology. So somebody who has not prepared pediatric hematology and was giving the pulmonology exam, that exam is gone for him. So I would say, like, even if somebody is giving INISS, he should be at least well versed with the most important topics from all the rest of the chapters as well: pediatric cardio, pediatric rheumat, nephro, everything. For that, again, it comes down to Nilofer. Sorry, come down to Nelson and the Q banks.
Yeah, great advice. Like I also feel that general pediatrics, you can't just just the general part, the non-specialty part, you can't just ignore. Even if you're preparing for analysis, even if somebody is going for neonatology, they can't ignore the systemic ped. So I would say have a NEET assist kind of prep anyway. By default you should have a NEET assist kind of prep. But yes, before the INA exam, maybe depending on your focus, 1 to 2 months, you can completely go into your specialty specifically, but never ignore the at least the breadth of the topics of the entire of pediatrics. Yeah, great. And like obviously, like you might not have given interview in any of your entrance, right? You always gave the Peds Pulmo part of PGI, right?
हाँ sir, only pediatric
So
pulmo I
your
have
was
given.
almost
Last
CR.
time I hmm, हाँ.
Right. And yeah, so again, like a little bit of guidance for juniors, whether they are through their MD or at the end of their MD, especially in pediatrics, when there's a confusion whether or not to give DM. Like, can you give some broad guidance for juniors through these phases?
So somebody who is right now doing MD pediatrics, I would only suggest them to be very honest to their branch. So see the patients and work with the patients. Read those topics which are related to the patients that will stick onto your brain. So in that way, you are actually doing justice to your course and as well as helping yourself because the topics which we revise, uh, topics which we revise at the time of clinics, they actually stick in your brain and they will help you even in the time of preparation and revision and all. And if suggestion, I would also suggest them to read Nelson textbook, nothing less than Nelson. If somebody wants to read any other book, I would advise them first read Nelson and then read some other books if they are really willing to read.
Correct. And what about, like, after having this amazing achievement, like whom would you like to thank? Obviously, there's a support system behind you.
And definitely, sir, my family, my parents, my wife, my akka, baba, everyone, and the staff, the Department of Pediatrics in GMC Sangareddy, and also Nilofer Hospital, all my professors who have encouraged me right since MD Pediatrics time. So I would like to thank them all.
Great. Like, it was great talking to you, Rahul. Like, especially for me, it was very happy as soon as you messaged me. It didn't click immediately, but then when we talked on call, and then I remembered our older call, and like it felt so nice. Okay, we'll keep meeting, Rahul. You'll anyway join PGI Chandigarh, and I'll see you around.
Sure, sir. Thank you. It's my pleasure talking to you. Thank you.